The Indian patient often has a short lower face, and working on the chin can really enhance the look of the lower face. So here you can see I'm using a 25 gauge cannula to slowly introduce and lengthen the chin by injecting in what we call as the C1 point. It's a nearly painless injection if it's done gently, and through one entry point we can actually address this concern, and you can see that the patient is quite comfortable, and the pre-post immediately shows a significant change with reduction in the mental crease as well as elongation of the chin, giving a very nice proportion to the face. And in fact, many a times this is a neglected area, and it supports not only the chin, but this also helps with protrusion of the lower lip, because that's another area which starts to invert as we get a little older. The chin also can be enhanced at the apex. So now I'll be introducing Juvederm Voluma, that's the product I'm using, and you can see with this cannula that I have injected, there is a upturning of a corner of mouth, and definitely the look on her right side looks better than the left. Now I'll be introducing a needle into what we call as the C2 point, which will help actually to give a little bit of anterior projection to the chin, as well as give a nice triangular chin. So in the female patient, we're trying to give a little bit more of a triangular look, and if we compare it to the male patient, wherein we are going to be doing more of a squaring. So across the face, where we're thinking of curves, it's more for women, and when we're thinking of angles, it's more for men. Definitely fillers is a misnomer, because we're not really filling out gaps, we are actually slowly creating contour and trying to give the best clinical outcome with zero downtime, and we're not really overfilling the patient. What we're doing is we're just trying to get the proportion back. So in facial aesthetics, we talk a lot about the 5 ratio, whereas that's the golden ratio of the face. And you can see now I'm introducing a small needle into the chin of the patient, and it's done quite gently. She's pretty comfortable, and this one injection point will really help to give a lot of character to her lower face, give a nice V. And again, the product I'm using is Juvederm Voluma. The key to success is to use very slow injection. So if any of you are trying to learn how to do this, then please, slow injecting is the key. Always aspirate, so you're ensuring that you're not having any sort of vascular injury to the patient. And it's a single site injection. So in a woman, we don't want to create a cleft of the chin as you compare it to a male patient, where you don't mind doing the same injection point at 2 sides. So you're giving a nice cleft to their lower face, and that is also important, because a cleft in a man is pretty acceptable, but in a woman it might sort of masculinize her face. So the assessment is very important, and the other thing is we have to ensure that the injections are as per the gender of the patient. So now once we've done with this injection point, now I'm going to further inject in what we call as the JW4 point of the patient. And as we start to age, there is some hollowing and there is a discontinuity of the jawline. The anterior-most jawline is actually like an overlap, the chin and the jawline. So I'm going to be marking that, and then I'll show you how it's going to be injected in this patient. And you can see it's very comfortable, and we don't have to worry about pain because the products are really advanced, and there is already pre-mixed anesthesia in the product. So to all the patients who are watching this video, please be rest assured that's a very comfortable procedure with minimum chances of any sort of problems, and the results are amazing. The best is that they last for a long time, and that is an essential thing, that if you are getting some sort of filler injection, the duration of a good quality filler would last you at least a year to year and a half, and then you can always go in for your next injection session. So now I'm going to be working on what we know as the pre-jowl, and also giving a little bit more character to the chin, because as we age we start losing volume from the lower part of our chin, and that gives like a dent into the jawline, which is a very often area which gives away the age of a patient. And this support to the jawline and the chin actually will help to control the jowling in a patient. And as we age, we all start to jowl, so we're going to just support the chin and the jawline to give a sort of lift, and that will reduce what we call as the mentolabial fold, and it will also reduce what we call as the pre-jowl sulcus. So the discontinuity in the lower face, which is also known as the JW4 point, we do with the cannula, again a micro cannula 25G, make a small opening, and you can see very smoothly the cannula is introduced and the patient is pretty comfortable. And once the cannula is in, we're like recreating that anterior jawline and giving a beautiful chin continuity. And in a woman, we're trying to make like a triangular chin. Thank you.